So when you begin, what did physiotherapy look like then, and how have you seen it evolve right now?
The doctor thinks, the person has to do exercises and they have to give சூடுவத்திரம் கொடுன்னுவாங்க இல்லை ஒரு வேக்ஸ் போடுன்னுவாங்க இல்லை கரண்ட் வைங்கன்னுவாங்க. இதுதான் terminology typically we hear in those days. But in the last 22 years, different department has evolved. Like, we have ortho, we have pelvic, we have neuro, we have cardio. So how do we make this more engaging factor for them? So then I made the chocolates coming in front of them. My head lifts, the chocolate comes and has to reach.
That is so sweet of you. You understand the psychology of the kids very well. So many clinicians hesitate to step into research. How did you build that bridge yourself?
See, when I hear a statement from Abdul Kalam ji and everyone, if you have a dream and you think about it, something will try. When chikungunya that very badly to all the people, the patient started coming. I was in Thiruvanmiyur clinic. So that time I was suddenly thought, if the patient with pain is coming, is it a male or female is getting more affected? Which age is getting more affected? Which area is more affected? So that we can tell the government there's a lot of mosquitoes where we can go and hit the spray. Each and every data which we treat is very, very important. And nowadays, any other patient is coming, they're also asking the data.
For someone new to this space, what is the first step to explore digital physio practice confidently? Welcome to 1% Physio Podcast, where we uncover stories of physiotherapists and LK leaders who push 1% beyond ordinary every single day, because it's all about 1% doing every day, which will make you a great person. So I'm Dr. Sandhya Ravi, a physiotherapist, your host, entrepreneur, and also lifelong learner, on a mission to make India the physiotherapy capital of the world. So that is on the mission where I am doing everything. So today's episode is very special. We are talking to a leader who had beautifully combined clinical research, evidence-based medicine, and digital therapeutics. So nowadays, everything about AI, VR, AR, a lot of amazing things are coming up. So someone who's bridging the gap between the lab and the living room. So please join me in welcoming Dr. Shyam Ramamurthy, sir, a senior clinic research and digital therapeutic leader with over 22 years of experience. He led global pharmacovigilance team, collaborated with institutions like Harvard and Mayo Clinic, and scaled VR and AI-based rehabilitation program across India. So we welcome you for the 1% Physio Podcast, sir.
Thank you, Dr. Sandhya, for the warm welcome. I'm happy to be part of this.
Thank you so much, sir. Let's dive into his 1% journey, because that is what today the podcast is going to be all about. From a young physiotherapist to a pioneer at the crossroad of science and technology. So what first drew you to physiotherapy?
See, that's nothing special about it, because in those days, we know only 2 degrees. Okay. My mom used to say medicine or engineer. So in my house, I am the first graduate. Okay. So I couldn't get through medicines. So other option I had, one of my friends said, there is some field called physiotherapy. So why don't you give it a try? So I got a dental, but I'm not much interested towards it. So when they spoke about physiotherapy, where you can see the entire human body as whole, and other interesting thing they said is, so once you finish the degree, you will get the degree in the US.
Okay.
So that was a thing, and that's how I landed up joining physiotherapy.
Fine. That's great, sir. So was it a personal story or an inner calling during that time? So option was not there, so that accidentally you got into it.
Absolutely, there's no personal story. There's no personal story into it, because I want to do a medicine for sure.
Yes.
I did get it in Karnataka, CET, but unfortunately, due to that Tamil Kannada problem, the final call out was there. So I was a bit down. I mean, somehow someone guided the field of physiotherapy. That's the first time hearing about physiotherapy, to be honest. And that's how I got into physiotherapy. And I never want to apply to any of the arts and science degree.
Okay.
I either want to do medicine.
Yeah.
Or anything related to medicine.
Okay, that's great. So when you begin, what did physiotherapy look like then, and how have you seen it evolve right now?
When I got into, I joined in Ramachandra. So when I joined, luckily I had a great teachers who were teaching me, from the time of anatomy, physiology. I had a teacher like Dr. T.S. Ranganathan, Dr. Jambulingam.
Okay. Wow,
So,
really?
so they're the pioneers.
Yes,
So
we
when
have
I
read their books.
absolutely, when I got mentored and taught under them, that gave me a lot of interest. Anatomy, physiology gave me a lot of interest, and psychology, and sociology, and I got trained under Dr. Preetham, Dr. Rajkumar, who's Lifeline head now, and all the good mentors. And I thought, in those days, we had most of the collaborative classes with medicine and all those things. I thought it was a wow factor when learning through them, and even the case assessment diagnosis, where we would be part of a neuro team, we would be part of ortho team, and we would make to present the cases in front of neuro ortho medicine team. So we were as a one team which we are doing it. So it was very, very interesting and learning factor for me when I joined.
Okay, that's great. So how it's been evolving currently? Like you're also seeing in terms of, because that's what I'm saying, whatever name you said as your mentors, like all we have read their books. So like very common book is a physiology. It's easy because
Yes.
like learning like guidance physiology was very difficult to understand. So Semmelingham's physiology was very easy for us to go through last minute notes and things like that. So I'm surprised to hear that. Okay, you got to learn from legends like that. So and how you are seeing the evolving happening in the field of physiotherapy.
It's a paradigm shift. I would say
Yeah.
it's a paradigm shift because those days, physiotherapy means there's only electro and exercise modalities. The doctor thinks, the person has to do exercises and they have to give ஒரு சூடோத்திரம் கொடுன்னுவாங்க,
Mm.
இல்லை ஒரு வேக்ஸ் போடுன்னுவாங்க,
Okay.
இல்லை கரண்ட் வைங்கன்னுவாங்க. இதுதான் டெர்மினாலஜி
Yes.
typically we hear in those days. So people come there and get treatment. அது ஃபிசியோதெரபின்னு ஒரு காமனாக இருந்தது.
Mm.
But in the last 22 years, there's a different department has evolved. Like, we have ortho, we have pelvic, we have neuro, we have cardio, and there's a special finger hand. So it's like, the medicine has evolved. Physiotherapy has evolved along with that.
Yes.
So we see a channel of paradigm shift where now they call even the doctors, instead of saying and the sudodani and the current, go and meet a physiotherapist, go and see this pediatric therapist, go and see the neurotherapist, go and see the cardiotherapist. So we as a rehab profession, we formed our own identity by making a good rehabilitation to the people who are in need. So that's a good shift which I see now.
Okay. So now there's a lot more AR, VR,
Absolutely.
AI.
The technology is also, not only the subject, there's a lot of medicine is advancing toward the robotic surgeries. We also advance to, digital therapeutics modalities, like, robotics, VR modalities, sensor based modalities, and we know there's recently which I saw, the gravity eliminated treadmill walk.
Treadmill walk. Yes, yes.
So that's all amazing.
Yeah.
And in hydrotherapy, making them to walk. Treadmill inside the hydrotherapy, making them to walk. So, which I see, the innovation part of rehabilitation is wow.
Yes. Even I recently, when I went to Bangalore, in one place there was gravity eliminator, because there is like this osteoporosis patients and things, putting on the treadmill is not easy for them. Like when this happening, the rehabilitation, I was literally amazed. Like we were thinking, like, what are the options are available for them, but now it shows like for everything there is possibilities. There is nothing.
Segmental traction.
Yeah.
That's amazing.
Yes.
So a lot of innovations.
Yes. Yeah. So then, was there a mentor or a patient who changed your perspective early on? Is there someone like you want to mention?
Yes. I had a mentor, Dr. Sundar. So 2003, after, I had a perspective of physiotherapy. Then 2002 to 2003, I joined a specialized course, neurodevelopmental therapy. Then I had one good mentor called Rajkumar Rajan, sir. So he was a trainer. So the way we approach a pediatric patients has completely changed, because I don't have much exposure during that time. And when I learned the depth of pediatric neuro, it's a wow factor. And how when you have to treat a pediatric kids, right? So we need to leave our inhibitions. We have to be like them. We have to understand them. and we have to treat. That's a good learning. With that learning, when I joined 2003 in Dr. Sundar Clinic, you know, those days getting a job was not so easy. Those who finished BPT and masters, they say come and join as a trainee, and that was the most of the masters went and joined training in a big corporate hospitals, big corporate hospitals. So when I joined here as a chief physiotherapist, I saw a doctor who's successfully running a physiotherapy practice. So when I say something where people are seeing other side, when I see some person is blooming with this physiotherapy practice, that has changed my shift of it. In addition to that is explorations, not only into the physiotherapy, research sector, ergonomic sectors. So then I saw it's not that we stick on to neck pain, back pain, which comes to our thing, and ICU management or whichever management. There's a lot of things that is happening in physiotherapy, like ergonomics is there, there's the research is there, and we can do a kind of study coordinator, sub investigator was there. So these are the things which luckily had a mentor like Dr. Sundar, which man of exploration. I started exploring things along with them.
Yeah, I completely agree to the last statement what you said, like man of exploration. I completely agree to that. So even I get to learn a lot. Like I'm happy to be associated with Dr. Sundar sir as well. So you have spent more than 2 decades in healthcare. Like how has your meaning of being a physiotherapist changed? Because when you start, like as you currently said, like it is like current கொடுப்பாங்க சுடு தண்ணி கொடுப்பாங்க ஐஸ் கொடுப்பாங்க அந்த மாதிரி தானே, like right now, like how the meaning being a physiotherapist got changed for you?
So as I said earlier, the meaning of physiotherapy is completely changed. It's like MBBS, MD, neuro, ortho, cardio specialist. Physiotherapist is a specialist now. So we are looked as a specialist.
Okay.
So in a group of any discussions in any hospitals or on a rehabilitation perspective, physiotherapist has been called for discussion what to be done. So I see physiotherapist is getting more and more evidence structured based outcome.
And nowadays, like the recognition of being an independent practitioner is also like
absolutely,
that's a big achievement, I think. So getting the council and things, got the recognition from the government also, that is something. Because recently, like I saw, like there were 2-3 instead of World Physiotherapy Day, like where Modi personally mentioned physiotherapy. So that is something, because this have never happened, because I'm also like completed my graduations a decade ago. Like even that time I've never seen. This past 2-3 years only I see like there is a lot of talk about physiotherapy is happening in media, in so many other areas.
Many movies also, characters is coming like a doctor, physiotherapist, and I'm going to physiotherapist.
Yeah.
So many movies also I'm seeing that, and I've not met Dr. Annamalai in person, but I owe my thanks to him.
Yeah.
Getting a lot of works done on the field of physiotherapy.
Thank you so much. Like last time when I went to Delhi, like I met him personally for my second book launch.
Amazing.
Yeah. So he's a man of prison with few words, but doing with action. So that was a good thing to know.
I was impressed.
Yeah, that's great. Yes, sir. Then if you could describe your early years in one word, what would be and why?
Early years means?
Yeah, early years being a physiotherapist. Not now, during that time.
Yes, it was a good journey. And as I said, it's not good and bad. It's not as easy as it is. So, the innovation has been part of me, right? So, my first innovation started when I joined Dr. Sundar Clinic after doing this rehab, this thing, right? The kids comes to our clinic, they start crying. The kids comes to clinic because somebody's going to stretch, there's going to be pain, and somebody's going to make them to do something which they don't like.
Yeah.
So how do we make this more engaging factor for them? So then I made the chocolates coming in front of them. My head lifts, the chocolate comes and has to reach.
That is so sweet of you. So, you understand the psychology of the kids very well.
So the head control is one of the challenge.
Yeah.
And the reach is also one of the challenge. So I wanted to create something as stimulus. When we create a right kind of stimulus, right kind of achievement will come.
Wow.
So that was my first thought. I think now that's been practiced in Bobat as well. Create a right environment and stimulus.
Yeah.
So yes, it was good, lot of learnings, and I've explored myself uh, into the field of pediatrics, into the field of research.
Yeah.
My research started in 2003 itself, along with physiotherapy.
Okay, then I can take one word as explore.
Explore.
Yes, that's a good one. So that passion became the seed, and right now we can see the powerful transformation in the digital therapeutics area and as a clinical researcher as well. So what inspired your move from clinical practice into clinical research and pharmacovigilance?
That's very interesting. See, when I was doing my 10th standard, my teacher asked me one question: what do you want to do? I want to become a scientist. Why? I want to get them develop a drug for AIDS. That time AIDS was
Yes.
still right. So I want to develop a medicine for AIDS. For doing that, I thought only the MBBS was an option. I have to do MBBS, then I have to do a research, then I have to do. So in 2003-4, where I had an opportunity to be a part of a big research group as a sub-investigator on a spinal cord injury study, which we did, double-blinded placebo study. So that was my eye-opening, And then a physiotherapist, we can also explore into the field of research. We can contribute something for the development of a research.
Okay.
That's the eye-opening for me.
Fine. Now I got it. You always like to be a scientist. That made you to get into the healthcare space. I thought you were completely interested in being a doctor, but it was something bigger purpose.
Yes,
Yeah,
scientist.
it's something bigger. Yeah. So many clinicians hesitate to step into research. How did you build that bridge yourself? Like,
As I said, it's my childhood passion.
Yes.
There's nothing that. So, see, when I hear a statement from Abdul Kalam ji and everyone, if you have a dream and you think about it, something will drive.
yeah.
So this all I didn't plan. This all happened.
Okay.
I had only thing I have to do something in the field of research.
Okay. So you put that 10th standard being a scientist, the universe have opened the doors for you.
I would say that.
You have manifested it.
I would say that.
Yeah. So, what were the first lesson you learned about data, evidence, and patient safety that every physiotherapist should know? Like, because you are very lagging in this terms called data.
It's very key.
Yeah.
Very key. Until unless we do everything structured, we know what is what is what, we're not able to tell something very confidently.
Yes.
So when the confidence comes, when we know what to say, what to say comes from the data which you have supporting for you.
Yeah.
So each and every data which we treat is very, very important. Starting from back pain or neck pain or shoulder pain. See, I strongly believe many of the physiotherapists would have treated lots of patients. A person shoulder pain or neck pain or this thing. So that patient itself could have been a study.
Yes.
That patient itself could have been, that would give them a lot of clues for us to see. When we do data, when we do analysis, it just not also tells us what we are doing and also will guide us what to do next. What to do next, where we need to target, where we need to focus, which is the pain point. See,
Yes.
When chikungunya that has hurt
Emerged.
very badly to all the people. So when the patient started coming, right, I was looking out for the patient started coming. I was in Thiruvanmiyur clinic. So that time I was suddenly thought, if the patient with pain is coming, is it a male or female is getting more affected? Which age is getting more affected? Which area is more affected? So that we can tell the government there's a lot of mosquitoes where we can go and hit the spray.
Wow. Yeah.
So this is where data will make us to do. Yeah.
So now this is a new perspective I got at. Like, I think so most of the physios who are listening to the podcast also, because most probably we always think as a clinician, but actually each clinician our research is also within him. Only thing is, like, the right question if you ask, automatically that can be converted, and even that can be a study like where it's going to help future more patients in the same scenario.
Absolutely.
That is very important, because now I liked it. So hereafter, like, I'll make sure, like, whenever a new person comes, okay, like in this condition, what is the same age group? What is common age group are coming to me? So what is the major problem they are facing? What is the ideal activities which is affecting because of
Absolutely.
this shoulder pain or whatever it is? So that is something different, because most of the time people think like fever, uh, dolo. It's very
Absolutely.
common. But actually in physio, it's not that easy. Most of the things are very tailor-made and custom-made. And example, there is a knee pain. Problem is in the knee. But the problem in their day-to-day, what you're facing is completely different.
That's true.
Yeah, because sometimes it's knee pain, no? That's knee pain. But a person with knee pain, one person, the problem is climbing stairs. The other person problem is standing for a long time.
That's true.
That's completely different problem together. What do you think about it? Because people think knee pain means we can put for everything same kind of therapy or same kind of rehabilitations also being thought.
Mm-hmm.
Yeah. So do you think bringing
Yes.
a standardization is good, or physio is generally very personalized and tailor-made?
No, standardization is good.
Yeah.
And as the dosage varies,
Yes.
depending upon the intensity of fever. They say, no, take thrice a day or take twice a day or take off a tablet.
Mm.
So even a paracetamol, it's been tailor-made based on the severity and based on the age, based on the
Yes.
conditions, everything. This is also, there's a structure, right? Either you go with this or this or this based on that, and based on the age, based on that what kind of job nature. So typically this, when it comes to the knee pain, it could be a job nature. Is there a tailor or it's a watchman or
Yes. The occupation.
occupation? That's very, very important, which we need to look into it. And it's food habits, the diet habits. So it's not only treating a pain, it's how do you look the person as
Person as the whole.
whole. So that's how
Yeah. But most of us we see it as a patient than a person. What do you think about it?
the perspective has to change. I think nowadays the when any other patient is coming, முதல்ல எத்தனை நாள்ல சார் சரியாகும்? They're also asking the data, right? எத்தனை நாள்ல சார் சரியாகும்?
Yeah. How many days?
So we should have something to say,
Yes.
right? So now recently I'm doing a lot of researches on strokes, right? So இந்த மாதிரி ஸ்ட்ரோக் வந்தா ரைட் சைடு வருது, மேலுக்கு வருது, இல்லை எம்சி இன்ஃபாக்ட் இருக்குது, இல்லை தலாமஸில் வருது, இல்லை பேசல் கேங்கில் வருது, அது மாதிரி இடத்துல வரும்போது என்ன வருது, அது எப்படி நம்மளுக்கு ரெப்ரசென்ட் பண்ணி மே நாட் பி சேம், ரைட்? ஸோ வி நாட் டன் அ ஸ்டடி, பட் இது ஒரு கிளஸ்டர் பண்ண முடியும். 60-70% கிளஸ்டர் பண்ண முடியும்.
Yes.
அந்த 70%ல் எந்த இம்ப்ரூவ்மெண்ட் நிறைய வருது? அப்பர்லும் நிறைய வந்திருக்கா, லோவர்லும் நிறைய வந்திருக்கா, ஸ்பீச் குயிக்காக வந்திருக்கா? ஸோ அது மாதிரி அனாலிசிஸ் நம்ம கொடுக்கணும்.
Yes.
As a RIA professions, when you start, இப்போ நீங்கள் ஒரு knee surgery பண்ண போகிறாங்களோ, ஒரு abdomen surgery பண்ணால் அதுக்கான outcome சொல்லுவா. Similarly, when we try to brief them like that, that would take our profession very next step.
Yes, I completely agree to that. So that was really, because when you understand a little more deeper, we can give exact outcome based knowledge or clarity to them. Example, if it's more right dominant, but actually
Absolutely.
generally like if right dominant, the chances of recovery is much faster because the person himself want to get all right with the dominant hand. So that is major, because we have seen a lot of neglecting syndrome also.
Absolutely.
So that this data is generally we know, but sometimes we don't educate the patient in telling that, see, this is your right dominant when we give therapy, because the patient does also want to get all right. But if it comes to the non-dominant hand, already their dominant hand is doing good, automatically they're going to neglect. So then a lot of other consultation. The recovery is much late than the dominant side. So when we explain them clearly, educating them, that's going to make
I would like
sense.
to add one more point.
Yes.
Once you start doing it, start publishing it so that many people can learn from you. Right? So that's very, very important.
Yeah. So, but the problem is like when clinicians are doing, they don't have an awareness, way to publish, can be a single case study, can be done.
Yes.
So those all things are there, because the guidance is where it's lagging here. Because example, we see a lot of cases, like how to go and publish it in a journal, like most of the people are not aware.
If there is a unique case,
Yeah.
and you see there's a unique, there's a rare case scenario where you do some impact, single case study is accepted. In a journal like Indian Journal of Physiotherapy and Occupational Therapy. And there's other journal, is Science Journal, Journal of Science. So there are a lot of journals are there
Okay.
which would accept.
Fine. Yeah. So maybe in the end of the thing, you can share your mail ID or something. Anyone is interested to publish in a journal, maybe they can get guidance from you.
Sure, absolutely.
Thank you, sir. Uh, s- um, you have been part of large scale studies. Any experience that changed how you view healthcare system because of that?
See, it's where from a physiotherapy practice, from the front end of a study coordinators, where I do the kind of documentation work to the larger studies. That's a ocean. Then I understood how development of each drug works and what are the teams has to be there, and how many validation they're doing, to get the drugs, because developing a drug is as much as important that is not giving much harm to the patients. So how many things. So with that knowledge, the way I look physiotherapy is completely changed. Now what I'm talking with data, what I'm talking of the evidence, what I'm talking about, structuring what we do, is all the it's all the what I learned.
So I think so from there only the standardization must also like
Yes, standardization is
yes,
must.
yeah, correct. Because like that also reduce a lot of confusion in the people.
Absolutely, ambiguity will get reduced.
Yes, correct. For physiotherapists listening, what's one way they can start contributing to research today?
Each day, each patient.
Okay,
Is
so
a
whether
research.
you're publishing or keep the data so that some or the other time you
Absolutely,
can
each
apply.
patient, I would say, is a Bible or Bhagavad Gita.
Yeah.
So
Yes.
start documenting each patient's because ஒரு வருவாங்க ஐஎஃப்டி அல்ட்ராசவுண்ட் கொடுத்துருங்க, இல்லை பெயின் இது பண்ணிட்டு போயிடுவாங்க, இல்லை எக்ஸசைஸ் பண்ணுவாங்க. பட் ஒரு பேஷண்ட்டை பாருங்கள், நீங்கள் கொடுக்கறதுக்கான எஃபெக்ட் என்னன்னு பாருங்கள், 2 நாள் என்ன பாருங்க, அது பார்ப்பாங்க, பார்க்க மாட்டாங்கன்னு சொல்லலை, அது எழுதுங்க.
Yes. For research, is there any particular structure or methodology, like this is how the documentation or data collection needs to be done?
Absolutely.
Or something is there.
Absolutely.
Like, in case if they want to get that so that they can document it and keep it, anytime when they want, they can. Is there any particular website or something when they can go and see the structure of all these things?
I would say, there's not particular website. There's a way of standardizing the assessment, which you and everybody knows.
Yes.
On the assessment format, on the international classifications of assessment. So when we make that as very structured format of doing it, we'll get that result.
Okay.
For example, in case of a stroke, we talk 3 things that would affect, right? The spasticity, and how the stroke is progressing, and how the outcome is measuring. So we have a standard classification, modified Ashworth scale, Brunstorm, film score.
Okay.
Each, there's a lot of scores that comes in, but select 2 or 3 golden standard assessment,
Okay.
and put that in a assessment and measure it. That's how your data, my data, all our data will get validated.
Yes, that's great. Because sometimes we have our own assessment methodology and things, we only continue that way. But actually practically that applies, but sometimes doing and keeping this one also is going to help us in a bigger purpose.
Because let's understand, all the scales or outcome measures didn't come just like that.
Yes.
It has gone to a lot of
Research.
That's why I said, make one golden standard thing. In case of ONE, OMAC or COOS, whichever, choose 1 or 2, which is internationally acceptable. Have that as a factor of your measuring factor.
Fine. Thank you so much, sir. And now, like already we've spoken, and right now you're work more into digital. So, like technology entered the scene. Now, like everyone is talking about AI, ML, AR, VR, and things like that. How do you explain the digital therapeutics and VR and AI based rehab in simple terms for our physios? Because still a lot of people are not aware about these technology in terms of implementations. So they feel it like they have this phobia called tech phobia. Oh God, it's completely taking me out of my comfort zone. How to get adapted to that? How can I update in these areas?
See, all the technology that is coming into a market, is just to make your life and patient life much comfortable. That's which we'll have to think about it. And as a clinician, it's you're always, we always have rights whether this is going to validate my purpose or not, right? So that's how the question comes with the clinicians. We are enna pannom, AI enna pannom, what we cannot do. Yes, that's not going to யாரும் மாத்திராது, but it will help you. It's like how robotic surgery is helping you to the precise the things, minimize the losses of blood, and healing, discharging, recovering much faster, along with the skills which cannot be replaced by any of this. So this is how the VR and AI is also implementing, because I chose VR as one of the greatest platform, because as a rehab நம்மளுக்கு தேவை வந்துட்டு ஒரு இன்டகிரேஷன் ஆஃப் சென்சரி இம்பல்சஸ் டு த பிரெயின் தான். அதுக்கான அவுட்கம் தான் நம்மளுக்கு வரும். இப்போ கையை தூக்கணும், இப்போ நீங்கள் பேசுறதுக்கு ஐ ஹவ் டு நாட் மை ஹெட், ரைட்? ஸோ இட்ஸ் த இன்புட்ஸ் விச் கோஸ் டு அவர் பிரெயின். ஸோ இந்த இன்புட் அது விஷுவலாக இருக்கலாம், ஆடிட்டரி, டச், சிட்டிங், ப்ராப்பர் ரிசெப்ஷன், எல்லாமே வந்துட்டு ஒரு இன்டெகிரேட்டடாக கொடுக்கக்கூடிய ஒரு ஸ்டிமுலஸாக வந்து விஆரை நாம் பார்த்தோம்.
ஓகே.
ஸோ அந்த விஆர் வந்து டிவைஸ் அது எங்கே வேணாலும் கிடைக்கும். அந்த டிவைஸை வச்சுட்டு when you make it, அதுக்குள்ள ஒரு எக்ஸசைஸ் when you make it more gamified with the biomechanical part of it and neuro structure inbuilt in it, like PNF technique or constraint induced movement therapy technique, இதெல்லாம் அதுக்குள்ள ஒரு எக்ஸசைஸ்க்குள்ளே கொண்டு வரும்போது then it makes அந்த என்வரன்மெண்ட்டை கொடுக்கும்போது then it makes a therapist life and a patient life more engaging and motivating to get the outcome.
Okay.
So then with this AIVA, we are also getting into a lot of predictive analysis. இது பண்ணும்போது we get into data, right? The ROM, shoulder repetitions, இது பண்ணும்போது. ஸோ இந்த ஸ்டேஜில் இருக்கும் போது எவ்வளோ ரெப்பிட்டேஷன் தேவைப்படுது for the next level. ROM போகும்போது
what is your fatigue level,
endurance level, and how does we progress. So all this data then will become more and more automated one. So when we treat thousands of patients, at least 70% of our the predictive analysis is going to be right, which would help physiotherapists to treat a patient in a much more better way. And it will make a rehabilitation practice standardized across. Because ஒரு Tier 1, Tier 2, சென்னை, பாம்பே, ஒரு மட்டும் there's a very ஒரு ஃபெசிலிட்டி இருக்குது, அங்கே போனால் ஒரு ஃபெசிலிட்டி இல்லை, அந்த நாலேஜ் லெவல் இதெல்லாமே ஸ்டாண்டர்டைஸ் பண்ணோன்னா இது மாதிரி வந்தால் தான் உண்டு.
கண்டிப்பாக that was a really good one. And very important things also, nowadays, like patients also love kind of innovation. So, and as you said, as this is not going to replace a physiotherapist, this is going to who is going to replace this? A person who is not getting updated in these areas. Person who is updating to VR and AR will replace a person who is not updated with that.
Absolutely.
So that is the only thing, because when in 22 years of experience you see like how much the evolving in terms of the maybe the therapeutic modalities, or like maybe the rehab processes, because earlier like even the few standards also got changed. From rice to price it got changed. Now it says like for the current trend the earlier thing is not working. So because the recent research says directly you should start with the movement instead of resting first. There is nothing wrong, because that's going to start with the oiling process much faster. So less weight bearing with load and things are also good. So when everything is changing, if you're not ready for the change, then we will be stuck, I think so. Yeah, so that was good one, because when you said that it's a catalyst. Just get updated. Thank you so much. I hope like people will start at least going and search in Google what is AI, what is VR, what is even if they have done like that, we have done the task.
Absolutely.
So what breakthroughs or outcomes have you seen that true technology can amplify rehab? Because I know like there is a number of case studies for you to say, maybe one or two which is exciting.
Yes, the recently which we did about 50 patient study in a government institute, where we don't want to be biased with our outcome. So we wanted a PMR doctor to do an initial assessment and also the reassessment of the outcomes. The stroke patients, which we took acute and subacute conditions, and we took the Berg scale and film score and modified Ashworth as one of the outcome factor, along with the VR and motion sensor digital report that's coming out. So when we did controlled group. One is 135 patients was given this, and 30 patients is conventional physio. So where we seen with this report, there's about 87% of enhancing recovery is seen when VR is given along with the conventional therapy versus only the conventional therapy. So this is one of the recent study which is going to published also.
Yeah.
So this because when we are trying to do this, even the PMR doctor, the physiotherapist, at the reluctant,
Yeah.
how it is going to support all those things. When we each patient when we documented and the doctors assessed and reassessed,
Yeah.
when we found this outcome, that was wow factor for me as well.
Yeah. No, the thing is like sometimes we as physiotherapists, we forget our basics. Sometimes I think so because for sure, whatever right now the study said, for sure the VR is going to always lead. The reason is VR is most active based.
Correct.
Conventional therapies are not active based.
Absolutely.
So your recovery is always active, whether it comes to learning or whether it comes to whatever in your life. When you are actively involved, your progress is going to be always amplified.
That's true.
But when
Well
you're
said.
passive, it's not. So sometimes when people ask me, as I do online, my own online works like whatever the modalities, whatever stretching you do on your patients, everything is passive. Until the patient is involved, whatever treatment we are going to give, it's until the patient involvement is there, the recovery will be slow. But as soon the patient response rate, the patient's active responses is initiated, the recovery will be fast, which can be easily done with the digital therapeutics, with doing digital rehab. It's not very difficult. But only thing is our perspective have to change, I think so.
I think it will change.
Yeah,
It will
it's
change
changing.
soon. It's changing.
Yeah.
So I'm optimistic about it.
Yeah. No, a lot of people started using this in their clinics and things.
Yes. So when I started developing this product, all these things were now top institutes start using it.
Yeah.
It's Vitas, Niman, Sakra, Neot. So
Yeah.
need is there.
Yes. And also like we are seeing sensor-based, AI integrated EMGs. There are a lot. When I went to Karnataka PhysioCon, when I went at it, there was like a lot of stalls. I think like everything was new to me. Like, oh God, like when all this came here. Each stall had a different amazing product. When you go and explore, then feel like oh, what is happening? So India is completely moving towards the digital India. Suddenly I remembered, yeah, digital physiotherapy is happening. Yeah. So what myths or fears do clinicians have about digital tools, and how do you address them? Because as soon you would have got a lot of resistance when you initially try to take it to the market when it comes to digital technologies. How did you address it?
One is as you said, as a rehab professions, we see our hand speaks.
Yes.
So I mean, I 100% I don't deny that factor.
Yes.
Yes, definitely our hand speaks, no doubt about it. And say technology is going to consume time. And I'm not a tech savvy. I'm not studied technology. I'm a clinician. So these are the typical challenges, which is a forecasted challenge. It's nothing new because this same challenge happened in US also, not new to India.
Yes.
Even US had the challenges. So when we showed them how this technology programming made his life, patient life, much better. When he's treating about one patient at a time, his clinical skills is going to give one patient, but the same 1 hour when he's going to treat 3 patients, where his clinical skill is going to impact 3 patients at a time. One is on the patient outcome, on the patient impact, is making a change because even the VR or whatever which we give, the program has to be set by a therapist based on his skills, based on his assessment. So at the same time, instead of treating 1 patient, when he's treating 3 patients, of his knowledge is getting, thing, and also his business.
Yeah.
So the slowly people started
Yeah.
accommodating to it.
Yeah. And satisfaction rate from the patient is also very high.
Absolutely. Patience.
Yeah.
Because it's engaging, motivating.
Yes, exactly. That's the biggest factor which is missing in terms of exercise therapy.
Absolutely, it's engaging.
Yeah.
There's a concept called flow theory because we are the mobile, everything we work with the concept called flow theory. So when somebody get immersed with what they like, they don't think about spending money and time into it. That's how people lose money in the gambling. That's a flow theory.
Yes.
So similarly, when that destructive phenomena made it very constructive,
Yes.
then the outcome is going to be which you are doing right now.
Yes, correct. Instead of watching Netflix, when you can do a VR gaming to improve your stroke, it's better. Yes.
Absolutely.
So, how did your physiotherapy foundation help you understand and humanize technology? Because without that, this is not possible.
It's a base. So the physiotherapy, when you study body as a whole, the deep of anatomy, deep of physiology, and depth of biomechanics, and how the pathology is impacting the biomechanics, right? And how this exercise therapy is helping us, or physiological imbalance or anatomical dysfunctions. So it's the physio biomechanics. I always loved the brain because
Yeah.
it's very, very passionate. I used to study Grace, I used to study Guyton, and it's so amazing that our human body is all about.
Yeah.
Until unless we know our base very strongly,
Yeah.
the technology cannot be evolved.
Yeah.
Because all this technology is based on this.
Yeah. I took physiotherapy because I was very obsessed with neurology, brain. And you believe it or not, in my first year, I was always will be with my Snell's anatomy. People will look at me like, are you mad? Anatomy is like this because I was always fascinated like how this brain works because people have done less work. But if you ask me now, will you do neurology? I said, no. Enough, already a dulling lot. But like, which made me to get into things, I was very fascinated, but I was not ready because I'm not very good taking medicine myself. So I was not very strong enough to prescribe to someone else. So I was looking alternative. That time I got physiotherapy. So that was the major reason I came into it. So when you talk about the neurology and these things, the biomechanics and everything connecting, then I felt like I've taken a right decision that coming into this profession.
Absolutely.
Every day it fascinates. Every day it's a learning in the field of physiotherapy.
Yes.
And I have a big gratitude you as a senior because you paved us a pathway
Thank
so
you
that
so much.
we can follow it from there. Because we know it's not an easy journey of being a physiotherapist so early. They are the one who struggled a lot because we are bearing the fruits currently, but without you all, so I'm just taking as it as my responsibility in terms of giving gratitude to all the senior most physiotherapists in the podcast today. And for someone new to this space, what is the first step to explore digital physio practice confidently?
Learning, adoption.
Good. That was a good one. Very short but it was like punch. And you have scaled teams from 4 to over 120. That's incredible. What did that journey teach you about leadership? Because
Leadership, I always think about empowering team. So leadership is not a dictator's. Leadership is empowering. And as a leader, we should understand our team very well. What is the strength and what the support they require. And how do we make them to grow in their organization and empower them on that. So when we do things to them, and our vision and mission has to be very clear to the team. So as if you said leaders, look at Mahatma Gandhi ji or Netaji Subhash Chandra Bose. They had a vision. They communicated it. People followed it. They didn't force them to follow.
yes.
Leaders will not force them to follow.
Yeah.
People will follow.
Yeah.
I would say that's the leadership.
Yeah. And they are also led by as an example as well.
Absolutely.
Yeah. So
You
it's
have to
not
lead by-
something like you tell the others do. You do so the others follow it.
Exactly.
Yeah.
You have to lead by examples.
Yeah. Thank you so much. That will like giving, because without them right now we can't live in our country like so free as how we are
Absolutely.
doing. So today like we will say grateful for them also. Yeah. So How do you balance empathy and efficiency when leading clinical team? When it comes to patients, we are always empathetic, compassionate, but sometimes that is missing in terms of managing a team or something like that. So I needed to know like balance empathy and efficiency when leading a clinical team.
See, what I would do is to my team is tell them what they're supposed to do,
Hmm.
guide them what they're supposed to do,
Hmm.
give a strong feedback when they not listening what they're supposed to do.
Hmm.
So it's not only always patting at their backs and appreciating.
Hmm.
Sometimes you need to have a there's a six thinking ads, right? So we
Yeah.
need to wear an ad where the feedback has to be given. Feedback has to be given,
Yeah.
no matter what,
Fine.
because we should show them the bigger picture of that,
Yes.
and their contribution, how important they are
Hmm.
in their contribution. Because typically what happens in most of the organization is we talk about all this, contribution, and you have to do all those things. But when you're expecting that from them,
Hmm.
it's key responsibility of an organization
Hmm.
to show them the growth path.
Yes.
If the growth path is not there,
Hmm.
with the promises, with the commitment which we make,
Hmm.
then the team will collapse.
Yes.
So it's a dual responsibility. What we say, as we say, right? Lead, follow.
Yeah. So, and as you were telling, like suddenly I popped up with looking at the current generation because they're very sensitive, openly to say. Like they are not very comfortable with the no. They're not very comfortable with these things. Like, and obviously you may have current generation also working with you. Like, how do you handle them as a team? Like, I need some glimpses on that because it's a big question. Like whenever I meet a physiotherapist, they always ask me. It's very very difficult to work with the current generation in the clinical team and things like that. I'm not saying they're so good because they do things very faster. That is how they think, and as I've already said, they want to become grow in one night.
Yes, it's a very very interesting one, because I not only led this team, I led the global team,
Yeah.
and this young team who was joining, right? So in those days, people come for a work with some commitment, passion. They need to grow all those things. Now, and my time, there's no job.
Hmm.
We need to get into a job. The family has to survive.
Yeah.
So the Charles Darwin theory struggle of existence were there. So now the struggle of, I mean, there's the the choice of options are there with the
Correct.
youngsters, and the discipline. I don't know. I should say this word discipline or all those things, but what I say, yes, managing these people, as I said, right. My NDT helps me on this.
Yeah.
I said, right, the pediatric. You have to come up with individual, understand what they are.
Yes.
So now I see a lot of people, the young generation, with great, amazing ideas.
Yes.
Amazing ideas. And they think very fastly. So what the only lack I see is on the execution.
Yes. Consistency.
Consistency. Execution, this. See, when you talk to them, I said, why I didn't think all these things?
Yes.
How come they're thinking so differently?
Yeah.
But where they miss is the
Yeah.
consistency and execution. If they develop this, and those are the days gone where the typical organization tells, dictates, commands. If you are in that mindset of making a team to work, then you're not able to work.
Yes.
I said, for them, give them the freedom,
Yeah.
give them the rights, and grab the freedom when they're not doing it right.
Yeah.
They will accept it.
Yeah.
Because this generation, when you're open with your communication, when you're open with the talks, I feel this generation is very, very acceptable,
Yeah. And they're very adaptable also.
very adaptable. We just have to be open. We don't have
Yeah.
to do all the sugar coats and the jam between the two. This generation is
Yeah.
super intelligent.
Yeah.
They know what we are saying. So
Yes.
just tell them what they have to do. That's all.
Yeah. No, that's what, because most of the time is we don't know like how to communicate or how to handle them. That is the major gap is happening in the industry. So
Yes. So
This one.
don't use a lot of dictating words to them. That's what I learned.
Yeah. This one, I think so. This will be a great learning for most of the clinicians who are having therapists under them or like having team. This is going to help them a lot.
Just tell them, this, if you could have been done this much more better.
Yeah.
And with this, ask them the questions. Okay, you say this, right? Then tell me what is the answer. Next day, they're not coming to them, boss, you told me this. Tell me what do we do much to get those answers. Get them into more of probing things. We get the work done from them.
Yeah. And they love challenges.
They love.
They love challenges. So give them challenges. Your work is done.
Yes.
Yes. Thank you so much for sharing that, sir. And working with Harvard and Mayo Clinic, what global insights did those collaborations bring?
See, Harvard and Mayo Clinic, I work for our rehab practice. So it's where I did study for the low back pain, other one for the Parkinson's tremor. So in a physiotherapy, when we do a real structured protocol along with them to measure and being questioned by them, how do we measure, how do you track, how do we do evidence, which I had in my experience in my previous company, but on the drug perspective. But on the exercise perspective, it's so different.
Yeah.
So when we put that into a structure, the very interesting factor about the Parkinson's, about the drug off-label of those time. So when you take a drug, within 3-4 hours, the drug dosing will reduce and the tremor increase. And that time we need to give an exercises of that. Right? There's a எப்படி ஒரு மெடிசன் ஸ்ட்ரக்சராக அந்த டைம் கொடுக்குறோம் அந்த டைம் கொடுக்குறோமா, அப்போ எப்படி எஃபெக்ட் ஆகுது, அப்போ உனக்கு ஸ்லீப் எப்படி இம்ப்ரூவ் ஆகுது, அப்போ உனக்கு அந்த ட்ரெமர் எப்படி குறையுது. It was a great perspective.
Yeah.
It was a great perspective of learning.
Okay. So when you come into this also, all this experience on learning helps you do better and better things. Right?
Yes. Keep learning.
Yes. Thank you so much, sir. And can you recall a leadership challenge that tested your values and what you learned from them?
There are many things, right?
Any one example or story, something like you like to share as...
See,
because we like to learn a lot, because when it's put into a story, like we'll never forget also.
Yes, leadership challenges would be there on your commitments. Right? There could be a days where things will go right for you, things won't go right for you, and as an whole organization, as a team. So how do we tell them? How do we tell them? How do we make them to understand? So, and leadership, everything is challenge, and then those people who do a lot of job to pacify you to get the promotions. How do we set them right expectations?
Yeah, correct. Because sometimes that do a lot of conflict between our values and the skill what we are holding.
So it's not that you just being close to me, you'll get the promotions.
Yes.
Right? It's just being how you do your jobs, how you make impact to the company, how your values making contribution to the company. So these are challenges
Yes.
which you would overcome on a daily basis. And how do I make sure that my company is also growing? Because a team, you have a different buckets of team, right? One will be a revolutionist in your team. Always not talking revolution. நான் ஏன் இதை பண்ணணும்,
Yeah.
இன்னொருத்தன் எதை சொன்னாலும் பண்ணுவோம்.
Yes.
இன்னொருத்தன் வந்துட்டு
People pleaser.
இன்னொருத்தன் வந்துட்டு அர்த்தம்னு சொல்லிகிட்டே இருப்பான்.
Okay.
He won't do, but he'll make
Delegation.
பார்த்தீங்களா நான் அப்பயே சொன்னேன் எல்லாம் நடக்காதுன்னு. நீங்கள்
The gossiping also.
gossip. So, and one is they never bother about anything. They'll focus on their job. So we need to manage this, put them a buddy role, and then get the things done. So people management is an art.
Yes.
It's not comes with the thing. You have to understand.
We also should understand, and also like for all these things, your entity is helping a lot. I can understand that. Because once you understand the personality type.
Correct.
Because when you talk about 6 thinking as general, I was thinking, oh yeah, because generally we never got to learn these processes during our college, except clinical.
Absolutely.
This thing is we have never learned like management skills or like documentation process or like the communication with different people. We know like how to communicate clinical, evidence based and things like that, but like how to understand a person. Yeah. So what is their social economical factor also we have to see.
Yeah.
Because the person is a person. He's not just a machine. That it's not like a
Good.
car.
Yeah.
Something happened, take the part and put the new part. That is not
human.
how the human being works. So thank you so much for sharing that. And I also, because I hope like you can tell them to read about the concept called six thinking.
Six thinking, yeah, it's leadership skills.
Leadership skills, personality of
That's
different people. So the major thing is like, how can physiotherapists make sure research actually reach patients?
By giving them the documentation of what you do. Because typically what I've seen in my practice is, ஒரு 5 நாள் வருவாங்க, வலி குறைஞ்சிச்சாமா, குறைஞ்சிச்சு, நல்லா நடக்கிறாங்க, சரிம்மா, ஒரு 10 நாள் 20 நாள் கழிச்சிட்டு வாங்க. But the report doesn't go to them.
Yes.
What they did, what problem they come, and what we did, and how the thing is improved, and what do's and don'ts. Like typically any discharge summary if you see,
Yeah.
do's and don'ts, when to call the doctor. So இதெல்லாம் வந்து சின்ன விஷயம்தான்.
Wow.
அதை நம்ம பண்ணாலே போதும்.
That's great. Then I think so like each therapist giving a discharge summary to the patient will be the great thing
discharge
to do.
summary.
Yeah. So
And
that
when
will
to
make
call.
that may complete a difference in the profession as well. Yeah. I will implement it, so for sure. I'll take this as a point. So how do you see telephysiotherapy transforming access to care and data generation?
It's need of hour. It's need of hour because the world is expanding and people are choosing for a right kind of rehab professions. Next, traffic. Right? People doesn't want to travel. Everything they want to do at the doorstep. So there was the days where we wonder, can we do a tele rehab? And physiotherapy is all about touch, all those things. Can we do? But now there's a lot of way which we can do a tele rehab with exercises, prescribing through digitally, and we monitor them through digitally, and we track them through digitally. Yes.
Yeah.
I think now it's a need of hour, and especially in the exercise programs.
Yes.
In case where I see it's playing a major role, and it's a proven success.
Yeah.
There are a lot of studies has been done on this, and a lot of positive outcomes also is seen into it.
Oh, I will also document everything, sir. I'm doing for past 4 years, but I've never documented. Now I'm going to take this
Yes,
learning
absolutely.
from you and I'll do it. Yes. And where do you think physiotherapy will be in the next 5 years, especially with AI wearables and all the digital therapeutics?
It would be more of very advanced technology with not only clinical practice, hybrid models, tele-rehab, technology at home, and people assisting technology. Like, the people started a kind of an hospital setup at homes now has come, right? So similarly, a kind of rehab setup at homes, rehab setup at the office working space with technology inbuilt into it, tracking them, monitoring them. That would be the next future which I see.
Yeah, even I've seen technologies like where camera can completely access your gait and will give you the feedback and things like that. A lot of things are happening.
Yes, so it gives you immediate performance reports, feedback reports of your body, like a new platform which I'm developing. I don't know whether I have to say or not, but I'm just telling.
No, sir. I will be happy to know that.
So in a master health checkup where we do a lot of the master health checkup, but I'm developing one platform to do a master health checkup for a human body digitally.
Okay.
So it's almost done.
It's completely physiotherapy angle
Physiotherapy angle. It's almost done.
Yeah, I'll be happy to look into it. Because the next one, now already it started. People started asking, can we do a master physio checkup?
It's already done. It's digitalized.
Yeah.
It's completely evidence-based report generation.
That's super great.
With the quality standard, so it's already done.
Any name or you like to reveal or something like that?
No. Just now the study and validation I'm doing it.
Okay, once
soon
it
it
is
will be
done.
released.
Fine. So maybe during that time you can come and talk about that also. I'll be happy to learn, to bring it to the world.
Yeah.
Thank you so much, sir. And what keeps you personally motivated after 22 years in healthcare? Have you ever felt like a boredom, taking a break or something like that? Because
I never felt boredom because
yeah.
When I was into physiotherapy, research, healthcare, then back to digital physiotherapy, want to make rehab more structured. The last 5 years, I'm completely into a physiotherapy and rehabilitation structure, making rehab more digitalized with the AI-based everything. So wherever this thing is that keeps me motivating is we are making impact to the quality of life of people.
Wow.
So when the recent platform which you developed called Jadu,
Okay.
a magic for neurodivergent kids.
Okay.
So this platform when we developed, creating a real-time simulations for the kids to experience, to reduce the anxiety, to become more socialized. So when I started experimenting that, doing a trial with the kids, when I see a positive outcomes, more than money, more than anything, that keeps me, one wow factor.
Yeah.
One wow factor.
Sure.
And stroke patients. I mean, it's not only me. Most of the RIA professions
Yes.
would agree.
Yes.
What would keep them motivating is
Their clients.
person says, "நான் நல்லா ஆயிட்டேன் சார் உங்களால."
Yeah.
நல்லா ஆயிட்டேன் மேடம் உங்களால.
Yes, that's very important. That was sometimes in comments, and thank you so much. ரொம்ப நாள் கழிச்சு நிம்மதியாக தூங்கினேன்.
அவ்வளவுதான்.
Yeah, that day you feel it like, oh God. Because they also worked for that, but when they come and say, ma'am, இவ்வளோ நாள் இல்லாத தூக்கம் இன்னைக்கு தான், like after a long time, I could sleep without any interruption. That makes us feel okay. I'm doing the right thing.
ஸோ இது இப்போ வந்து நம்ம ஒரு ப்ராடக்ட் பண்ணுறோம், ப்ராடக்ட் கண்டுபிடிக்கிறோம், ஒரு விஷயம் பண்ணும்போது அது பல ஃபிசியோதெரபிஸ்ட் யூஸ் பண்ணி பல பேஷண்ட் அதை இம்பேக்ட் பண்ணும்போது, சி மை விஷன் இஸ் நாட் ஐ எம் ட்ரீட்டிங் பேஷண்ட்ஸ் அண்ட் மெனி ஃபிசியோதெரபிஸ்ட் ஆர் யூஸிங் our platform to treat the patients.
Yes.
Making impact to the patient. That's motivating me always.
Yeah. So now, as soon as you said that word, now I started with the mission for me, which I'm working towards, to make India the physiotherapy capital of the world. Now I can see it's happening. Because now, like, I can see like a lot of changes is happening. Like, because earlier we used to get a lot of imported products, and right now, like, make in India and things like that. The knowledge and the physiotherapists in India, they are super successful, and they're coming up with new things. There are a lot of make in India products I'm seeing, which is much more advanced, much more very cost effective compared to the imported ones. And when it comes to results also, like, the trial and error is so less in terms of implementation. I feel like super proud about my Indian physiotherapy.
Absolutely, because our product is Indian made.
Yes.
So when I did it to very big corporate doctors, very giant doctors, is it Indian made? Are you sure?
Yes.
Believe us, sir.
Yes. No, we have a lot of talents and things. No, whatever we get imported, most of the products are Indian worked. But only it comes from other country.
That's true. Absolutely.
Yes. So anyhow, most of the places in research, Indian minds works a lot compared to any other minds in the world. And that happens in India. So that I see like a big progression and big. Now I feel like whenever Abdul Kalam said, like, India becomes bigger, like, everything is already happening. That person had this dream.
Absolutely.
Yeah, now I see like everyone is carrying forward the dream, and everything is coming true also. And we thank all the leaders who have been leading earlier too. And so how do you practice? Very important. Like, I know, like, you do a lot in terms of professionally. Like, what are the practices you do every day as 1% in terms of your physical health and your mental well-being?
It's very important.
And also your emotional well-being.
Yes, because as per WHO, health is classified into physical and mental, right, and social. And three are unstable only are called as healthy, not only physical. So we need to keep all the things very stable. Yes, like, I get up at 4:30 every day in the morning, and then I start my day cleaning my house.
Okay, wow. That is such an amazing spiritual activity, actually.
Yeah, I just start cleaning.
That makes you grounded.
Not grounded, for my fitness.
No, sir. And the thing is, see, sometimes we feel it like it can be given to anyone, but when we do ourselves, actually, like, it makes us who we are. Yes. Outside, people will look at so mighty and things, but when we take care of our own self, our own groom,
it's a family.
Yes,
it's family. Everything which how we develop a product for many impacts. Whatever we keep inside our house is a family.
Yes.
It's not the product; it's a family.
Yes.
So I start my day with cleaning my house, and then it takes me about 40 to 45 minutes a day, complete cleaning the house. So that keeps me fit. Then and then go for 15 minutes, 20 minutes of meditation, and have a cup of coffee. Then after that, my house is very near to the beach, so weekly thrice I just go for a walk on the beach. That's it.
Yeah, more than enough. So like literally morning you have your me time around 1 plus hours.
Yes, absolutely. I get
That's
up
very
4:30. Typically, I get up.
fine.
By the time everything gets over, by 6, my day are ready to get started.
Yeah. That is super amazing because always having a morning routine do you have any night routine also like before going to bed or sleep?
No night routine. So come home, finish my dinner by 7:30 to 8:30.
Okay.
Don't stress more than that. Evening chat, family time,
Yes.
then go to sleep.
That's more than enough. That is our amazing night routine. Sir, if you could give one percentage advice to the physiotherapists who are listening to the podcast, like what would it be?
Advice, I don't say it's an advice. What I would say is, everybody is doing an amazing job.
Yes.
But what they need to focus
Yeah.
on is on their evidence-based
Fine.
practice, data collections, and learning and adaptability to the new technologies, acceptance.
Fine.
I think that'll make them to scale to the new heights.
Fine. Thank you so much for that. And let's end it with a little rapid fire fun to know you beyond the profession. So that is the reason. Like leadership is in one word.
I said empowerment, lead.
Fine. Thank you so much. One thing physiotherapists should start doing today.
Research and study.
Great. One thing the healthcare system needs more of.
More of datas.
Okay. A habit you swear by. One habit which it's mandatory for you. Without that, you can't live.
One habit without mandatory, which I can't leave.
No, one habit. This habit define you, kind of thing.
I couldn't get the question.
No, sir. In your day-to-day activities, this one habit define you. Without this, you can't live your life. Is there any one habit?
Study.
Study. Fine. Research or rehab? Choose one.
Both has to travel together. When I have to do a better rehabilitation practice, I have to have a strong research.
So for current, like anyone, research or rehab, which one will you choose?
Research.
Fine. Coffee or green tea?
Coffee.
Okay. If not physiotherapy, what career?
No idea.
Okay. One word to describe your 1% philosophy.
Live your life.
One word. If you want to say it as your 1% philosophy. Can you say like one word philosophy?
I couldn't get the question.
No, sir.
Give me an example.
Example. Right now, like when you said empowerment is a kind of philosophy. Like giving to the community is a kind of philosophy. If you want to say it in a one word or a very short version of your philosophy.
Empathizing.
Yes. Yeah, thank you so much. Yeah, so that makes end of our program. Like, thank you so much, Dr. Shyam sir,
Sure.
sharing your inspiring journey from a passionate physiotherapy to a visionary leader shaping the future of digital health. So the digital health contribution goes a lot to you. What I personally loved is how you have shown the science, technology, and human touch can truly exist. All can coexist. That the spirit of 1% physio movement to keep learning, adapting, and growing just a little every day. To all our listeners, if today's episode inspired you, share it with your fellow physiotherapists and tag 1% Physio Podcast and leave a review. Until next time, keep moving, keep learning. Remember, your 1% today can become your 100% tomorrow. And this is Dr. Sandhya Ravi signing off. Thank you.